I will introduce myself. I'm Heather. I'm a nurse in Toronto, but I do not work directly with patients right now. And given everything that's been going on with COVID-19 precautions and our healthcare system being prepared for that, I wanted to talk to some of my friends who are working in the healthcare system. I'm friends with local nurses and doctors and paramedics and people who work in long-term care homes as well. One of those great people is my friend Monica Cato, who is here to talk with us this evening. Why don't you tell us a little bit about what you do and what your role is at the moment?
Well, I work in a long-term care home. I'm a restorative care assistant. And what that means is I provide one-on-one exercise, group exercise classes, and basically help the residents to maintain their independence in activities of daily living.
Nice. Yeah. So how old is your average patient?
I would say our youngest is in her 50s and our oldest is 104.
My
So
mom.
the
Yeah.
average is probably about 85.
Yeah. Okay, so you're working with a population that is, as you're well aware, in that risk zone for this particular virus that everybody's taking precautions for right now. And I know that our long-term care homes in Toronto and everywhere have been putting really tight restrictions in place because they're really nervous that their people that they care for are vulnerable right now. So I'm curious to know, it's a little different than a public hospital, a primary care facility. What is your long-term care facility doing? What does life look like right now to prepare for this?
It's a little, I don't want to say dismal, but compared to the liveliness of our home, it's a predominantly Italian population. So they're used to coming down to the piazza, having their vino and their music. So right now, they are isolated to their floors. They're not permitted to have any visitors. Uh, about a week ago, they were allowed if a resident was gravely ill or deemed palliative, they could have their family members in, and now not so much. So
Wow.
we
Not even
spent
for palliative care. Oh,
not
that's
even
so
that
hard.
now.
That's so
It
hard when
is.
it's a population that you do your best to keep active and engaged, and you want them to be visiting with family and friends and
Mm-hmm.
socializing, and all of that is off the table all of a sudden. So how have you and your colleagues been trying to explain that to the residents and to encourage them or support them through what is, I'm sure, really, really difficult to adjust to?
It's kind of a fine balancing act because we don't want to alarm them.
Mhm.
Being an Italian home, they are aware that there's this virus that's attacked their homeland, but they're not fully comprehending the enormity of it.
Yeah.
So they don't necessarily um, take it very well. We've been engaging with families, setting up FaceTime, Skype, Google Duo. So that's been our role from a recreation and restorative point of view, just going, with a schedule and
Yeah.
going room to room, and whether it's just 3 minutes or 15 minutes, letting them see their loved one. And that's been uh, really fun for them because technology is something that a lot of them aren't really familiar with, and as soon as they see their face in the screen, they're like, oh, my hair, my hair.
So yeah,
So
you can spend half the day getting ready to be on camera and then bring out the,
exactly.
I
Oh
used to
no,
work in a
lipstick.
I remember the great care we took to the details some of my little old ladies would take to get ready every day. Now they have,
Don't leave the room without their lipstick.
yes,
Yes.
exactly. So thank goodness for technology. That's something you can do. Now, what about being prepared with PPE, with personal protective equipment. I'm sure that you know worldwide, not just in Toronto, there's been a lot of discussion about whether or not healthcare providers have enough of masks, of gloves, of gowns, and there was even some debate, weeks ago, whether or not this was droplet or contact precautions or airborne.
Mm-hmm.
And so there's been a bit of a scramble to get supplies, and the people I'm talking to don't feel that they have enough. And there is some concern amongst healthcare workers. In your case, I'm wondering if you're concerned for yourself and also your residents. What are you thinking about that piece of this right now?
Well, as we spoke about earlier, like we just had our first confirmed case,
Mhm.
and it was a staff member. Apparently, her symptoms are mild. She's been off for the last 6 days, and awaiting her test results. And now that they're positive, some of the staff are really concerned because where they didn't feel they needed a mask before, now everyone is saying, I am not doing this or I'm not doing that. You give me my mask. And
Yeah,
they are in short supply, and they're kind of being rationed.
yeah,
And
that's what I'm hearing everywhere. Usually, even in our main hospitals, a couple of masks per day is being
mhm,
rationed. If you've trained to properly put these things on and take them off between patients, that you could potentially be changing all of these pieces 10, 20 times in a shift, not twice. So it's a challenge to do things properly, but also ration.
yeah, exactly. It's when you've been taught before, like if a resident is on isolation, before, if it was like a respiratory or an enteric illness, taught how to, change them. And now all of a sudden, oh, one mask will last you 8 residents. And I like, how does that,
Yeah,
how did the rules change so easily?
right.
So
So have you talked about this with your colleagues? What would you say is the general feeling on preparedness and workplace safety, and what do you feel like your position is at the moment? Do you feel like you're in a good position going forward? Are you prepared?
well, I feel like this is so new. Like it's new for everyone. This is not something that anyone's had to deal with. So I feel like communication could improve because I think, education is power. When you know what you're dealing with, then you can act accordingly. But so I feel like there's a little bit of apprehension. A lot of my coworkers are feeling like, I didn't sign up for this, and there's fear. You probably know as well that in long-term care, many of the the frontline workers, aren't necessarily young themselves, and so there's that fear of, what
Yeah,
happens
yeah.
if I get sick? And those that are young and have children at home, and it's not a job that you get in for the money. So there's that whole idea of you don't pay me enough for this risk. And
Yeah.
some are just like, I'm not going. I'll, especially in, young mothers that are terrified of bringing it home to their kids, or um, women from, ethnicities where there's the extended family, where, a grandmother lives at home. And,
Yeah.
and I'm hearing from some of my coworkers that the families are saying, do not bring this home. Like if this virus hits, you know, the care facility, like you're not coming home. Like,
I've seen images of doctors in New York that are camping out outside. They're not going home. They're staying in
yeah, I
tents.
saw that too.
Um, What's your routine when you leave your workplace now and you've taken all these precautions? What are you doing to give yourself peace of mind and to make your best effort not to bring this home with you?
My hands are raw from washing my hands.
Yeah. It's still the
Um,
best, still the number one defense is washing your hands with soap
yeah.
and water. Yeah.
And I think you really get used to doing that. Like before, you thought you washed your hands well, and now I bet you I go through the happy birthday song at least 5 times because twice just does not cut it.
Yeah.
When I get home, um, I just peel out of my clothes, throw them in the laundry, head for the shower, um, disinfect, doorknobs, whatever, even as I'm coming in, because I live in an apartment building as well. So they've got regulations posted what they expect of the tenants living there. Even the laundry is open 24/7, just so if you can't sleep, 2 o'clock in the morning is a perfect time to do laundry because you're not going to run
Sure.
into anyone. So,
Yeah, you can keep your 6 feet of distance. I think
yeah,
everybody is wiping down doorknobs and being careful of what they touch and cleaning things off when they get home. So much now. Yeah. You mentioned, I saw something the other day when you were giving an update on social media about how you're coping and what you're doing every day at work, and you mentioned bringing your guitar to entertain your residents. So how are you keeping spirits up? Is that one of the ways that you're bringing some entertainment and positivity and optimism into your day?
well, yeah, I think because of the way that we would keep them engaged before has changed so much now that they can't leave the floor. So it's more of I call it like the traveling road show, just keep my guitar with me. And because even the residents can't be in large groups, even on the floor, we have to separate them into like these little pods almost. So I just, travel from one little group to another, and it's more spontaneous. Like, what do you feel like doing? Because
Yeah.
of the population, they love doing the rosary, and especially now, prayer has become so important to them. One woman, I printed off Psalm 91 for her
Mm.
in Italian, large print. And when she first started reciting it, she was having trouble reading it. And now when she reads it, like she's just declaring and decreeing this over. So it's just the way her enthusiasm and um,
You can tell she's really drawing strength from it.
yeah.
Yeah.
So it's, even in a secular workplace, I feel like even among my coworkers, like you can see there's a draw towards faith because I think people are realizing like this is not just some little thing that's going to go away. And it's kind of interesting to see how people are becoming, curious about
Hmm.
faith, or, rekindling a faith that they had before that maybe had gone by the wayside. So,
Right. Yeah. When times get scary and the stress is on, they start looking for comfort and
yeah,
bigger answers to their questions and concerns. That makes a lot of sense.
exactly.
Okay, well,
So,
Monica, I would love to hear what you think from the perspective that you have going forward in the next week or two. What are you concerned about and what are you optimistic about? If that's a fair way to frame it. Do you have worries right now or are you hopeful and why?
I don't want to say I'm naive, but I've just never been a person to get into that mass hysteria. Like going into the grocery store a couple of weeks ago, I just found myself laughing, and I thought,
Yeah, so
and I
you weren't in line to buy toilet paper. No, neither was
no,
I.
no,
People people kind of go a little nuts.
yeah.
Yeah.
So I guess I'm hopeful that through all of this, people will start seeing what's really important, you know,
Mm,
relationships. I find myself and my sisters were spending, more time doing, video chats, things like
mhm.
that. The residents are starting to appreciate a little bit more what it is that we actually do for them because they can see the exhaustion. They can see they're afraid. I think some of them because they see things changing. Like even this evening,
Yeah,
they were all in the dining room, and then they were all taken out of the dining room. No, you have to eat in your room, and they were scared. Like, what did I do? Like, why can't I go to the dining room? Did I do something wrong? So there's trying to allay their fears, but then there's also the frustration of like, would you please just, you know, come
yeah.
back to your room? So
Changing routine. It's so
it's,
hard.
it is. Yeah, I find one of the challenges for me is I'm a hands-on person. Like I'm the comforter when someone is sad, like I want to give them a hug or whatever. And I went to do that this evening to one of the residents who was just like losing it. And one of my coworkers, get back. And I'm like, oh, are you
Oh,
kidding? Like, how do you encourage someone, comfort someone from 6 feet away?
it's not the
Yeah,
same.
and with
Yeah,
the language barrier too, because so many of them, Italian is their first language and they only know minimal English. So when you try to explain to them, they get frustrated. So
yeah.
I guess that's my challenge there is how to be, a responder from a distance. But I'm hopeful in that, like, I see our team pulling together. There was, my first impression when I started working there was that there wasn't that team mentality. I think through all of this, people are realizing we can't do this in silos. We have to work together and we have to cooperate and, celebrate little victories. When someone offers to, stay late to help out, that's huge because there's people that don't want to show up at all, much less stay late. So,
It's amazing how people can come together as a team in hard times. What that stress and pressure does for the cohesivity of your team. And I'm sorry that you have to experience it under these circumstances, but I totally know what you mean. That makes a lot of sense. So you're optimistic about that, which is good. Do you feel like this is going to that you're going to ride this out and keep the status quo in your facility? Because you don't have any of your residents sick with this at the moment, right?
no,
Yeah.
I feel like we've got a handle on it. Like, I don't know if you watched, there was a home further north that really was suffering, like they've lost 9 residents. And I
Mm,
watched their house physician talking about it, saying, well, the residents really like to get together and socialize, and we don't like to take that away. And I was
wow.
thinking, you've got 9 dead residents. It's not a matter of giving them what they want because you don't want to hurt their feelings. Like,
Right.
this is life and death.
It
So,
sounds like they have not been proactive, and in your facility you really have, and you're obviously suffering a bit for that, and your residents are, but it's necessary.
our administrator's already talking about the party we're going to have when this is all over. So, I
Yeah,
mean, I,
absolutely. A big Italian celebration. That will be so nice. And all the families can finally come. Oh, I really, really pray that that is going to happen soon. And it sounds like you guys do have a handle on it. And as well, I pray for your strength and energy because I can tell you're exhausted. I know you're putting heart and soul into working right now and taking care of your residents, and I'm sure they appreciate it.
Well, thank you, Heather. Prayers are always appreciated.
Thank you so much for talking with me and giving me some on the ground feedback about what you're doing and where you are right now. I'll check back in with you as well in a few days. We'll see if anything's changed. Let me
Sure.
know if anything changes, and we can talk again in a week or so if you like, and do an update.
Sounds good.
Awesome. Okay, have a good night. Bye.
Thank you. Bye.